Okay, we're talking about fever and the immune system. Up to now, we've been looking at strengthening the immune system and also giving vitamin C, which can generate hydrogen peroxide, which can kill cancer cells. But now we want to look at how to turn on that immune system. And that's what fever does. So why don't we start with prayer. Dear Father in heaven, I pray you can be with us as we look at the means that you've given us to turn on and stimulate our immune system to help us fight infections and cancers. We pray that you can be with us as we look further at this wonderful mechanism. We ask this in Jesus' name. Amen. Okay, so cancer, it's on the rise. In 1900, risk of cancer was 1 in 40. In the 1940s, it was 1 in 20. Now it's 1 in 3. And we're moving towards 1 in 2. How come? Well, we believe many dietary changes have happened, and that may be one of the main problems. And we've covered this in previous talks. Today we want to learn about the powerful immune stimulant called fever. We'll also look at hyperthermia, which is an artificial way of producing a fever. We'll review the history of hyperthermia, the rationale behind fever modalities, as hyperthermia is sometimes called. They sometimes call them fever baths. We'll also see how it's been used in the past and how it's being used today. So, is this approach effective? Well, to answer that, we need to ask, can a depressed immune system invite cancer? And if that's the case, then strengthening and in turning on the immune system would be expected to help prevent or help fight cancers. Much of the answer to this question comes from a biography on Dr. Dennis Burkett. From this source, a brief summary of his work follows. Who was he? Well, he grew up in England, and in his college years, he gave his heart to Jesus Christ as his Lord and Savior, and he felt called to serve as a surgeon under the employment of the African government in tropical Africa. 1957, Dr. Burkett was shown a boy, 5 years old, with deforming swelling on both sides of the upper and lower jaws. A biopsy showed a cancer, round cell sarcoma, highly malignant form of cancer. This was the first of many such cases he saw in his time in Africa. It affected children ages 2 to 12, peak incidence around 8, and it could affect the eye, the jaw, the abdomen, the bone, the kidney, or a combination of all. Now, he took safaris all over Africa to look for the distribution of it, and he found that it only occurred in tropical Africa, north and south of the equator. It was never found in South Africa. Now, this fit the distribution of sleeping sickness, of yellow fever, which is a viral disease spread by the mosquito, of nyong fever, which is pain in the bones, a viral disease also spread by the mosquito, and malaria, a parasitic disease spread by the mosquito. It never occurred where the rainfall was less than 20 inches a year, or where the temperature ever dropped below 60 degrees. That fit the distribution of these other diseases. You got to have rain, you got to have warm temperatures to grow the mosquitoes, and it was felt that because of this distribution, it was likely something being spread by the mosquito from one person to another, causing the cancer. Well, the only agent known at that time to cause cancer that could be spread by mosquitoes were viruses. So they hypothesized that a mosquito was transmitting a virus from one person to another. So the question is, can a virus cause a cancer? Well, let's look at where our understanding of viruses started. We go back to Louis Pasteur, 1884. While developing the rabies vaccine, he noticed something strange. He said, when I developed the anthrax vaccine, I could see the bacteria under the microscope. rabies, I cannot see any organism under the microscope. He said it must be an organism infinitesimally small. Now we know it was the rabies virus. Here is a view of the tobacco leaf disease. How is it transmitted? Well, in 1892, Iwanowski, he took a leaf that had the disease, ground it up with water, filtered it through a porcelain filter. Now, porcelain filter is fine enough to filter out all malarias, all parasites, all bacteria, all cells, but it's not small enough to filter out viruses. So you can actually use them for camping. You can filter your water that way. And so he took the leaf-water combination, filtered it through this porcelain filter. He took the water and put it on a healthy tobacco plant, and it got tobacco leaf disease. The infecting organism is known today as the tobacco mosaic virus. So we know that viruses can cause rabies and tobacco leaf disease, but can they cause cancer? Well, in 1898, Seideenham of Uruguay took some cancer tissue from myxomas in rabbits, ground it up with water, passed it through a porcelain filter. Under the microscope, no visible organisms. But when he took that fluid and introduced it into healthy wild rabbits,
Go ahead.
Alrighty. So, in 1911, Peyton Roos of New York Rockefeller Institute took a solid cancerous tumor, a sarcoma from a chicken, ground it up with water, passed it through a porcelain filter, gave it to healthy fowls, and those fowls got the sarcomas with this cell-free filtrate. All these instances of cancers being transmitted from one animal to another implicated an infectious virus. Were they ever able to see the virus? Actually, in 1935, Lenningham and Guy took tissue from the Roos sarcoma, which is a cancer, ground it up with water, and filtered it through a porcelain filter and put it under a high-speed centrifuge, and they saw tiny 70 millimicron sized particles, which they believed to be the Roos sarcoma virus. By the way, you can ask questions. I mean, if you don't mind being on the recording, that's all. Okay, so finally, 1945, they developed the electron microscope. And for the first time, they could now see viruses. And this is the modern version. This is the avian flu virus, which typical of different viruses that we see today. Yeah.
That's different than mass spectrometry. You know, the
Mass spectrometry.
Spectrum. It's a different type of microscope.
Yeah.
That's like the highest resolution you can get. Mass, is it called mass?
Spectrometry. I'd have to research that. I am not sure. I believe that's for looking for different chemicals in a substance.
Okay.
And looking at their densities as they come out. I don't know you get a picture from that though. 1946, Claude Porter and Pickles took a Roos sarcoma cancer cells and examined them with an electron microscope, and they found 75 millimicron sized particles throughout the cytoplasm. That's the outside of the nucleus in the cell. They found the virus in the cell, and they suspected it was a virus that was causing this cancer. Finally, 1956, Anthony Epstein definitely identified the 70 millimicron Roos sarcoma particles as the Roos sarcoma virus. And this was definite proof that the Roos sarcoma virus was causing the sarcoma in animals. 1957, Stuart and Eddy of the National Institute of Health propagated parotid tumor virus in tissue cultures, which induced a variety of tumors in mice and rats and hamsters. Now, up to 1962, studying viruses which cause cancer was mainly confined to animals. However, viral transmission of a cancer from one person to another had not been demonstrated, and now men were racing to be the first to demonstrate viral transmission from one person to another. So where do you look for a cancer that could be caused by viral transmission from one person to another. Well, with the distribution of Burkitt's lymphoma only in the malaria belt, that looked like the most likely cancer, Burkitt's lymphoma, to be transmitted from person to person by a virus through a mosquito. That's what they were thinking, and so now, all of a sudden, Africa is the center of attention. Was there additional evidence that viral transmission by mosquitoes was causing the cancers? Well, Dr. Burkett noticed that there are two areas in tropical Africa that had high year-round temperatures in tropical Africa that had the high rainfall, they had the high temperatures, they should have had the sarcoma, but they did not. These are the only two places that had eradicated mosquitoes with spraying. That was Kinshasa and Zanzibar. So get rid of the mosquitoes, you get rid of the sarcoma. Uganda, on the equator, they found where malaria was intensive, the lymphoma was intensive. Where malaria was not intensive, the lymphoma was rare. Again, implicating mosquito transmission of the virus. Finally, in 1964, Dr. Epstein grew tumor cells from Burkitt's lymphoma. And these cells were examined and found to be full of viral particles having a herpes virus morphology. Now, you've heard of herpes virus? Well, that's what it looked like. It was called Epstein-Barr virus. Has anyone heard of that? Epstein-Barr virus? Okay. Well, they found that all children with Burkitt's lymphoma had antibodies to Epstein-Barr virus, which implicated that they had been exposed to the virus, developed antibodies for it, and so that went along with the theory that the virus was causing the cancer. Case closed? Not exactly. They ran into problems. 1964, they discovered that 85% of healthy Americans also had antibodies to Epstein-Barr virus, indicating that they'd been exposed to the virus, but strangely, they didn't have the lymphoma. Now, most Africans also were exposed, but only some got the lymphoma. So the central question now was, if Epstein-Barr virus causes Burkitt's lymphoma, how could 85% of healthy Americans get it without getting the lymphoma? And another way of asking the question is, what triggers the virus to cause the lymphoma? Well, while pondering this, they made a fortuitous observation. In 1967, Tony Epstein's young technician, Elaine Hutkin, became ill with fever, sore throat, enlarged lymph nodes in the neck. She got a rash. Her antibody test for Epstein-Barr virus had previously been negative, now was positive. They had just observed what an acute infection of Epstein-Barr virus did. And when she saw her doctor, he diagnosed her with infectious mononucleosis. Now we've got a problem. Does Epstein-Barr virus cause Burkitt's lymphoma, or does it cause mononucleosis? Well, Yale doctors tested college students coming to college. They tested them for antibodies to Epstein-Barr virus. And if they tested negative and then got mononucleosis, they then tested positive for Epstein-Barr virus. It was 100% correlation. And so they did document that, yeah, Epstein-Barr virus causes mononucleosis. Well, if that's the case, why aren't Americans getting Burkitt's lymphoma, was the question. And why do most Africans not get it and yet have been exposed to the virus? So, what triggers it to cause the lymphoma? Well, they then identified the trigger. They found immigrants from tumor-free Rwanda and Burundi. They had no Burkitt's lymphoma and they had no malaria. But when they moved to Uganda, back up here. When they moved to Uganda, which had a lot of malaria, all of a sudden they were getting Burkitt's lymphoma. And they were getting it at an older age. It was, 8 years old, 12 years old. Now they were getting it between Well, a lot of them, 50% of them were over the age of 15 and 26% were over the age of 30. This suggested that getting malaria somehow triggered the virus from going from just latent virus to causing Burkitt's lymphoma. How could malaria trigger the formation of a lymphoma? The mechanism appeared to be immunosuppression. The Africans, the whole populations there, malaria is endemic. And they have malaria their whole lives. And their body is so busy keeping the malaria under control, their immune system doesn't have anything left to keep Epstein-Barr virus under control, and it progresses to a cancer. That was what they came up with. Now, is malaria persistent enough in Africa to cause immunosuppression on a large scale? Yeah, even today in the malaria belt, everyone there has a low level of malaria. Now, how do we know this?
Take ivermectin?
What's that?
They treat it with ivermectin, right?
We actually used a different drug there that was actually very effective there, but it was not approved in the United States. It hadn't cleared FDA. They actually have more effective medicines in Africa than we have here yet. So,
That's a shock.
yeah.
And it's a lot cheaper.
Yeah, it is cheaper.
Tough labor.
Well, we went on a mission trip to Africa when my son was, I don't know, 8 or so, and he got malaria. So we took him to, we were in Ghana here, it's right in the center. We took him to the Adventist hospital, because wherever you go in the world, you're going to find Adventist hospitals. And they drew his blood, they looked under the microscope and says, yeah, he's got a low level of malaria. And then he said something very interesting. He says, if he were a native here, we would ignore it because they've all got a low level of malaria in their blood and they're immune to it. But he's a foreigner, he's not immune to it. We got to give him the antimalarial drugs, and we gave it to him and he got better. But it did indicate that malaria is rampant there, and their body, again, is so busy keeping the malaria under control, it's got nothing left to fight the Epstein-Barr virus, and it progresses to Burkitt's lymphoma. Now, this is sort of an isolated example. Are there other examples of immunosuppression increasing the risk of cancer? Yeah. HIV is a common, well, it's the classic viral infection which causes severe immunosuppression. It destroys certain T lymphocytes, which are your soldier cells in the body. Can this lead to cancer? Quoting from an internal medicine textbook, up to date, HIV-infected individuals have increased propensity to develop malignancy. That's common knowledge. The occurrence of this unusually high number of cases and aggressive clinical course of Kaposi sarcoma, which is a type of cancer, was noted early in the AIDS epidemic. It also causes increased risk of non-Hodgkin's lymphoma and cervical cancers. So that is a definite risk factor for getting cancer. Now, there's another class of people who also have immunosuppression. These are organ transplants. If you get a transplanted kidney, your body would normally, your immune system would normally say this is an invader and destroy it. So to prevent the body's immune system from destroying it, we have to suppress it. We suppress it with different drugs. And when you do that, chronic use of immunosuppressive agents to prevent allograft rejection increases long-term risk of malignancy compared to that of the general population. Here's a list of the cancers that you are at higher risk of getting if you've had an organ transplant and are immunosuppressed. SIR, this is standard incidence ratio. You are 61 times more likely to get Kaposi sarcoma if you are immunosuppressed, have an organ transplant. And this is the excess absolute risk per 100,000 persons. That's significant as well. So, yes?
So that's why whenever we have a transplant, they gotta suppress the immune system so the body can.
The body doesn't destroy
If it
it.
is blood transplant, medulla, or the
It's-
blood transplant.
You can get a blood transfusion, they don't have to suppress your immune system. Just a blood normal blood transfusion. If you're talking about allograft transplant, it's a little different from the allograft transplant because you're destroying all the white cells, and that in itself is immunosuppressant, and then you're transplanting in new cells. So during that period, you're at risk for infections, but it's for a much briefer time than the rest of your life, say for an organ transplant. So it would be a transient immunosuppression. Okay, well, tonight I want to focus on stimulating or turning on the immune system to help fight infections, to help fight cancers. And we're going to see that fever is just such a stimulation, and this is why we use fever as a modality. So, do fevers turn on or stimulate the immune system and thus aid in combating infections and cancers? It's a question. Let's find out. Okay, so now everyone has known, either had or known someone who has had a fever in response to an infection. Many times antipyretics and anti-fever medications are given to suppress the fever. This is because today fever is perceived as something that needs to be suppressed. Yet historically, this was not the case. It was perceived to be something beneficial. So I want to take a brief look at the history of our understanding of fever to find out, well, who's correct? And I'm indebted for much of the following to Matt Kluger, who did much of the research the benefits of fever in the 1970s. He did animal studies, which were very dramatic. So where did our understanding of fevers begin? Actually, 400 years before Christ, Hippocrates wrote, "Nature never needs any instruction." He wrote that during an ulcerative eye infection, a fever supervening is favorable. Around 100 AD, Rufus of Ephesus wrote, "I think that you cannot find another drug which heats in a more penetrating manner than fever. For this reason, it's a good remedy for an individual seized with convulsions, and if there were a physician skillful enough to produce a fever, it would be useless to seek any other remedy against the disease." In the 1600s, the noted English physician Thomas Seideenham, he wrote, "Fever is nature's engine, which she brings into the field to remove her enemies." 1887, the famous German internist Dr. Liebermeister, he had studied fevers intensively. He concluded that fevers of moderate magnitude or high magnitude for short periods of time were beneficial. He cautioned against fevers of long periods, high fevers for long periods, as it could lead to a loss of body weight, appetite, and danger and degeneration of the organs. Only in high fevers for long periods of time did he advocate antipyretics or medications to lower the fevers. By the way, he was an interesting guy. He documented that it was the heart rate increased about 7 to 8 beats per minute for every degree elevation of temperature, indicating that your metabolism is starting to race at that higher temperatures. And that racing metabolism is one of the downsides of a fever. Now, however, today there is widespread trend to reduce all fevers with antipyretics. In 1970, Kluger wrote something interesting. He says, "One might surmise from this widespread attempt to reduce fevers that convincing evidence had been presented which demonstrated that fevers were harmful. This is not the case. If anything, the weight of evidence tends to support the opposite conclusion." Well, what is some of that evidence showing the beneficial effects of fever? Well, we go back again to Louis Pasteur. He's one of the first ones to note the benefit of fevers. In the late 1800s, Louis Pasteur was studying anthrax, trying to develop a vaccine for it. He could inject cows and sheep with anthrax and they'd be dead in a few days. However, when he injected chickens with the anthrax, They ignored it. They just went on about their lives. Couldn't kill them with anthrax. Now, a colleague said, no, hogwash, I can kill chickens with anthrax. But when he tried, he too was unable to kill the chickens with anthrax. Upon admitting defeat to Pasteur, Pasteur said, well, actually, I've now found a way to kill chickens with anthrax. He said, oh, really? How do you do it? Well, he related that he had found that chicken's temperature runs 104 to 107.5 degrees Fahrenheit, whereas cows and sheep run about 100.4 degrees Fahrenheit, just a little bit above what human temperature is. He postulated that this higher temperature in the chickens may be protecting them from the infection. So, what did he do? Experiment number 1.
Put him on ice.
He what?
Put him on ice.
He did, yes. Exactly. He wired a chicken's feet to a screen. He lowered it into a tank of water, filled the tank with cool water, immersing it the lower 1/3 of the chicken. He maintained the chicken body temperature at about 100.4 degrees Fahrenheit, close to what cows and sheep run. So he lowered the temperature to equivalent to a cow and a sheep. After inoculation with anthrax, the chicken developed anthrax symptoms, and 24 hours he died. That was it. He took another chicken, cooled it in the same manner, then he injected it with anthrax. After several hours, anthrax symptoms developed, and the chicken became listless and weak. At that point, he took the chicken out of the cooling bath, dried him, warmed him up. The chicken survived. No problem. Then, took another chicken and was inoculated and left at his normal body temperature, 104 to 107.6. It was then given anthrax. It developed no symptoms at all. A few degrees Celsius made the difference between life and death. So we're not talking about 5% had a decrease in cold symptoms and had cold symptoms resolve in 3 days instead of 4 days. And those are minor changes. We're talking about life and death in a chicken, a few degrees Celsius. Now, another more striking example of beneficial effect of higher body temperatures is found in humans. Hippocrates noted around 400 BC, described a mysterious progressive paralysis which would leave his victims paralyzed. However, he observed that in rare cases, a cure or long-lasting remission could occur if the victim acquired an infectious disease accompanied by a high fever. It was suspected that the fever was helping reverse whatever illness was causing the paralysis. It wasn't until 2,000 years later, in 1858, that Esmark and Jensen showed that progressive paralysis was caused by syphilis and was termed neurosyphilis. Well, in 1887, Wagner Jarig, he was a psychiatrist, he was researching neurosyphilis, and he noted that syphilis was endemic in China and India. Strangely, though, neurosyphilis was rare. They would get the syphilis, but they wouldn't get the paralysis. How come? He also noted that malaria was endemic in China and India, and as we know, would cause fevers. Now, we need to remember what Hippocrates said about paralysis remitting after a fever. So, Wagner Jarig, he said, could the fevers from malaria protect or reverse the neurosyphilis? So he came up with a plan. He thought, what if I give malaria, which is treatable with quinine, to patients with neurosyphilis? They would then get fevers, and I might be able to change an incurable disease, neurosyphilis, to a curable one, malaria, which can be treated with quinine. So, in 1917, Wagner Jarig took 9 patients with paralysis from syphilis, injected them with malarial blood. The results? 3 out of 9 had practically complete resolution of symptoms. This success led to further testing and treatment of thousands of neurosyphilis patients. Before malaria treatment, only 1% of neurosyphilis patients showed full remission. With Wagner-Jerig's therapy, over 30% had remissions based on a sample size of thousands. Malpractice, you say? Apparently, the scientific community didn't think so, for in 1927, Wagner-Jerrig was awarded the Nobel Prize in Medicine or Physiology for his work in treating neurosyphilis with fever therapy. Now, we've got penicillin today. We don't need the malaria, but it did show the benefits of fevers in malaria, neurosyphilis, excuse me. Have other diseases been treated with fever therapy? Typhoid vaccine was used to treat resistant forms of gonorrhea. These produced fevers up to about 104. These were moderately successful. However, there were side effects. The gram-negative bacteria not only produced fever, but occasionally produced septic shock or low blood pressure, which you need to avoid. Needless to say, we don't use that form of hyperthermia today. Is there more recent evidence regarding the beneficial effects of fevers? Well, in the 1970s, Matt Kluger did controlled trials to study the effect of fevers in infected animals. His work is summarized in a 1984 prestigious journal called Science. So, to study fevers in animals, he needed one whose temperature he could easily control. So during a boring lecture, it came to him, I need the dorsalis lizard, which is an ectoderm. See, being an ectoderm, the only way they can regulate their temperature is move from the shade to the sun. So he set up a large aquarium, put sand in it, shade on one side, sun lamp on another, put little thermocouples in their rectums, and would watch where they migrated. And he found that they preferred temperatures around 100.4 degrees Fahrenheit. Then if he infected them, they moved from the shade to the sun lamp. And the temperatures rose to 104 to 107.6 degrees Fahrenheit. They cleared the infection, and then they moved back to the shade. And that was their way of generating a fever. See, God cares even for lizards. Designed it into him. In a later experiment, he took several groups of lizards, and they were infected and maintained at different temperatures. At incubation temperatures of 42 degrees Celsius, the 3-day mortality increased in proportion to the temperature lowering, as shown in the graph. So at 42 degrees Celsius, survival rate 95% at 3 days. But if you keep them at 40 degrees Celsius, survival dropped to 70%, and so on, till when you get down to 34 degrees Celsius, they were all dead by 3 days. Now, something else to notice, in later experiments, several groups of lizards were infected and maintained at lower temperatures. At 3 days, the infections are cleared. There were no more deaths in these groups. But notice the 42 degrees Celsius, after the infection was cleared, they started dying. How come? Well, at 42 degrees Celsius, remember their metabolism is racing. They were dying of exhaustion. They were using up all their reserves and simply couldn't handle the higher temperatures and were dying because of exhaustion. And that is true. When you have a fever, your metabolism is racing. It's like climbing a mountain. You will be exhausted. And that's part of the discomfort in a fever. Well, if fevers are therapeutic in lizards, what about the practice of giving them aspirin to treat a fever? So to shed some light on this, he did another study with a group of infected lizards, and he gave some of them an infusion of aspirin, which what happened was the aspirin prevented them from resetting their thermostat high. And so they had no desire to move to a warmer climate. And if you watched them, they were all dead by 3 days if you gave them an infusion of aspirin. Now, some people may say, well, maybe it was the aspirin itself that was killing them, not the lower temperature. So I said, okay, took another group of lizards, infused them with aspirin, but then incubated them. And if you incubate the lizards getting aspirin, they don't die, 100% survival. And then, of course, they took the control group, infected them with Hydrophila bacteria, and they all survived as well. So, again, it kind of questions the use of aspirin to lower fevers. Similar results were found in goldfish infected with bacteria. Hydrophila is a bacteria that will infect goldfish. And when they were infected, they migrated to a warmer climate of water. In other words, their temperature increased by 5 degrees Celsius. Now, how do they do this? I don't know if you've ever jumped into a lake in the summer. The deeper you go, the colder it gets. It's true in an aquarium. They would be down here, but when they would get infected, they would go to a warmer climate. And that would be a fever for a goldfish. Yeah, 32.7 degrees Celsius is a fever for goldfish. When maintained at colder temperatures, their mortality, of course, increased in proportion to the degree of temperature lowering. Well, those are reptiles and those are fish. What about mammals? So, in this study, they took newborn mice, gave them Coxsackie B1 virus, which should have killed them, but they incubated them up to 34 degrees Celsius and maintained that temperature, which is the temperature of 8 to 9 day old mice, and they had a much lower mortality, fewer symptoms than the mice kept at 22 to 24 degrees Celsius. Newborn puppies. Newborn puppies, if they don't get their mother's milk and they get herpes canine virus, they die. But if they're 2 weeks old and they get herpes canine virus, they get a little runny nose and they survive. What's the difference? Well, one difference is that newborn puppies have lower body temperatures and can't mount fevers. Older puppies have higher body temperatures and can mount fevers. So they thought, well, maybe the fevers are the beneficial, the difference. So they took a bunch of newborn puppies. They infected them all with herpes canine virus. Some of them they kept at room temperature, their normal newborn rectal temperatures of 95 to 98 degrees Fahrenheit. And these all died within 5 to 8 days of getting the herpes canine virus. Other puppies were also inoculated and incubated to maintain rectal temperatures of 101.5 to 103 degrees Fahrenheit. And by 9 days, they were all still alive. One puppy died on day 9, one on day 10, but the others were sacrificed on days 13, 16, 21. One was given away as a house pet and is still alive on day 600. Again, a few degrees Celsius meant the difference between life and death for these puppies. When they did pathological studies on the puppies, the unincubated puppies showed widespread focal necrosis, small areas of dead tissue, and hemorrhage and bleeding. But the 2 incubated puppies that died demonstrated only a few minute petechial hemorrhages and cortices of their kidneys, much less spread of the virus.
So then if you have the fever and it has its opportunity to work in your body, you have more chance of getting over the illness that you've occurred.
Yeah, if it's an infectious illness. Yeah, infectious. Well, what would happen if we gave herpes canine virus to adult dogs that have higher temperatures already? What if we took their temperature and lowered it, dropped their temperature down? Would this allow the disease to progress? Well, they took dogs, older dogs, 4 to 8 weeks old, normal rectal temperatures 100.5 to 102. They inoculated them. They then anesthetized them, and they kept some of them at 94 to 97 degrees Fahrenheit. That was a lower temperature for 48 hours. Then when they sacrificed them, on pathological examination, these dogs, the virus was readily recoverable in the liver, the spleen, and lymph nodes, the lungs, the kidneys, and adrenal tissue. And when they did fluorescent antibody tests to look for the virus in infected cells, they found that the hypothermic dogs, they had numerous discrete fluorescent foci could be seen in the liver, spleen, and kidney, but in the dogs that were kept at the normal higher temperature, no fluorescent cells could be found. So, we've talked about animals and older human studies. Are there larger, more current human studies on the effect of fever in infection? Yes, there was one published in 2012. The purpose of this was to determine whether fever was associated with a increased or decreased risk of death in patients admitted to the intensive care unit with an infection. So to answer this, they looked at 130,000 patients admitted to the intensive care unit in Australia, New Zealand, and the United Kingdom with the diagnosis of infection. They recorded the peak temperature of the patients attained during the first 24 hours of admission. What did they find? They found that in the Australia-New Zealand cohort, the adjusted in-hospital mortality risk progressively decreased with increasing peak temperatures in patients with infections. That is, if you had an infection, the higher the temperature, the lower the mortality. The lowest risk was in people that had temperatures of about 102 to 103. It appeared that fevers were beneficial in preventing the death. Now, why the benefit? Well, it turns out that a higher temperature turns on or stimulates the immune system. How this happens is, we'll cover a little bit later. A stimulated immune system would be expected to help with an infection, which in this study it did. But what about a higher temperature when no infection is present? Well, a stimulated immune system would not be expected to help here. And this is what they found. In fact, in patients without an infection, the adjusted mortality risk increased when you got temperatures above 102. That is, with no infection present, the higher the peak temperature, the higher the mortality. Why this increased mortality? Well, at high temperatures, the metabolism is racing, which puts further demands on the reserves, the energy reserves that a patient has. And if you are having a fever, you're going to use up your reserves faster, and that could increase your mortality if you have no infection. If you have an infection, that increased loss of energy reserves is offset by an immune system that's turned on, and the immune system benefit overshadows that risk of using up your metabolites sooner. So,
can you say that again? So you're saying if we are running fever, doing...
Okay, if you run a fever, you're using up your energy supplies more quickly.
Right.
And if you don't have an infection, there's no benefit, there's just a deficit. But if you have an infection, the benefit of turning on your immune system outweighs using up your reserves more quickly. So it's worth the cost. Turning on your immune system costs energy. In an infection, it's worth the cost. If you don't have an infection, it is not worth the cost. And so you would not want a fever in that case. Does that make sense? Okay. Fever in the immune system. So what causes a fever anyway? Well, your body actually has a mechanism to produce a fever when it's infected, as shown in the figure. When a gram-negative bacteria, like E. coli, invades the body, its surface liposaccharide binds to the white cell's toll-like receptors. Or when a gram-positive bacteria, like Staph aureus, invades the body, its surface toxic shock syndrome toxin binds to the white cell's major histocompatibility complex molecule. And when that happens, the white cell sounds the alarm that we've been invaded, and it releases a pyrogenic substance. It's called a pyrogenic cytokine. Pyrogenic, pyro, fire, genic, give birth to. It gives birth to a fever. These cytokines produce fire or the fever we experience. This stimulates, how does it do it? Stimulates the production of prostaglandin E2, and this stimulates the hypothalamus to reset your thermostat higher. Your hypothalamus does this. Intricately designed systems like this were placed in man by a loving creator for our benefit, and it's put there for a reason. So how does this fever mechanism play out when we get infected? Well, when the body gets infected, it resets the thermostat to a higher temperature, say 102. Now, but we're still at 98.6. Our thermostat's up here. So are you going to feel hot or cold? Well, actually, if your temperature is below your thermostat set point, you're going to feel cold because you're not up here yet. So that's the chills you have. You put on a blanket, you start shivering to generate heat. The blood vessels on your skin constrict to drive the blood deeper in so you have less heat loss to conserve your heat, to bring a temperature up. When that happens, when you finally get to 102, now you feel comfortable temperature-wise because your temperature's now reached your thermostat set point, but you're exhausted because your metabolism's racing. It's like climbing a mountain. That's the exhaustion that comes with the fever. At that higher temperature, your whole immune system is turned on. You clear the infection, and once you clear the infection, your body resets its thermostat down to 98.6. But you're still at 102. So your temperature is exceeding your thermostat set point. From now you feel hot. You throw off the blanket, your blood vessels dilate to release the heat, you break out into sweat to lower your temperature, and your temperature comes down, and that's the normal cycle. In the old days, when parents saw their kids had a fever, they would watch for the sweat. And as soon as the sweat came, they said, the fever's broken, they're going to get better. And that was a good sign. And in fact, even in the hospital, if the fever's climbing and we want to get a blood culture, that's when we take the blood. If the temperature's declining and we get a blood culture, then less chance of getting a positive blood culture. Now, many people initially thought, well, maybe the fever is actually killing the bacteria, that higher temperature. Is that the beneficial effect of fevers? Well, there are some strains of bacteria that are killed outright at temperatures as low as 106 to 106.7. There's some pneumococci like that. And rabbits can get temperatures as high as 107.6. So a temperature in a rabbit may be high enough to kill this pneumococci outright. Gonorrhea are also sensitive to temperature elevations. They're killed at anywhere from 104 to 106 degrees Fahrenheit. However, killing syphilis requires much higher temperatures, over 106. But malaria temperatures very rarely get over 106. And yet, we saw earlier that Wagner-Gerig was helping to cure neurosyphilis with temperatures from malaria, which don't get over 106. So the temperature in that case was not high enough to kill the syphilis. Where was the benefit coming? We believe the benefit was coming because that temperature was enough to turn on the immune system. And that was all that was needed. So how does a fever turn on the immune system? These are T lymphocytes. They're your soldier cells. They help fight viruses and they help fight cancers. They're anti-tumor properties. When infection occurs, it enhances T lymphocyte activation and proliferation. at 102 degrees Fahrenheit, these are produced 20 times faster than at the lower temperatures. So at the higher temperature, your body is just pumping out these T lymphocytes.
I have a question. Is there
Yes, ma'am.
any other mechanism that can turn on the T cells more?
What other mechanism?
Yeah, any other mechanism?
Shiitake mushrooms, there are some studies with natural killer cells. You can increase the activation of those with certain shiitake mushrooms. At least they've done some studies with those.
What about sauna, steam bath, fever
That's
bath?
the same thing.
Yeah, we're going to get there. That's you don't have to have a natural fever to get this effect. Anything that will increase your temperature will give you this benefit. Whoops, I think we just missed one here. Okay. Interferons, that's the artist's conception of interferon. These are proteins that have antiviral and antitumor and antibacterial infections. When the temperature is raised from 102 to 104, interferon becomes more than 3 times as effective in fighting a virus in tissue cultures. Febrile temperatures dramatically increase interferon production as well. This is a white cell, and it's gobbling up these orange things, which are anthrax bacteria. And this is called phagocytosis. At higher temperatures, when you go from 95 degrees Fahrenheit up to 104 degrees Fahrenheit, the white cell mobility increases markedly, and some bacteria are killed more efficiently once they're ingested by the white cells. And the white cells move faster and they gobble up bacteria faster. By the way, once the white cell gobbles up a bacteria, it puts it in a vacuole, it has to kill it. And it kills it by another vacuole with lysozymes, toxic chemicals, binds to the vacuole that the white cell has put the bacteria in, releases the toxic chemicals to kill the bacteria. And one of the toxic chemicals in that lysosome is hydrogen peroxide, which we know is generated, which we talked about, generated by vitamin C. Interesting story about anthrax. We had in Guam, when we lived next door to an ophthalmologist, and his son would just read and read and read, just read everything. He was about 10 years old, and I was on my way to the hospital, and in the car, and he runs over and says, Uncle David, I got to ask you a question. I thought, uh-oh, watch out, because when he gets talking, he would talk and talk and talk, and I got to get to the hospital, and he goes, Uncle David, I was reading last night, and I think I have anthrax. I said, well, if you still think so tonight, maybe we can talk about it. Yeah, that's the danger of reading too much. Many bacteria need iron to grow. It's another factor. And at higher temperatures, the bacteria's ability to absorb that iron and use it is decreased dramatically. When you get a fever, the white cells release a substance which decreases the iron levels in your blood, stores it in ferritin, and it's called the anemia of chronic disease. And that makes it unavailable for the bacteria.
So a disorder in the blood, the person already has that anemia.
Anemia. It's not considered toxic. It's just it's designed to be for a temporary period of time while you're clearing the infection. The problem comes is if you have chronic inflammation, as in rheumatoid arthritis or something, that inflammatory process is on forever and ever and ever, and you can get lower iron levels in that case. And it's not temporary, it's more permanent. That can be a problem. It's somewhat difficult to treat. You can give iron, but you'll still may have that iron deficiency anemia. Febrile temperatures are also aided by low iron. The desert iguanas, they use this when they get infected by Hydrophila bacteria. They release this chemical. It lowers the iron levels, and they are able to cure themselves of the Hydrophila bacteria. And similar results were found in rabbits. They lower their iron levels, and that helps prevent them from infections. Okay, so a review of the benefits of fighting viruses with higher temperatures. This is an excerpt from an article, a review. It says that higher than physiologic temperatures, binding a bivalent antibody can neutralize pycnoviruses by irreversibly neutralizing the virus through disruption of the virion, which leads to ejection of RNA. Fever enhances this process in vivo, confirming the popular belief of the virtues of fever. You don't have to know any of this, just realize that they said, yeah, we know the mechanisms by which fever actually helps you fight viruses.
And is that for all cancers?
These are for viruses we're talking about. We're getting to cancers. A rise in temperature during a fever establishes a cascade of host defense mechanisms that increase host survival and induces T cell proliferation, we just talked about, differentiation, secretion of interferons, we just talked about, and antibodies and neutrophil migration. This is the white cells moving faster, gobbling up bacteria faster. So, it's useful in infections. What about cancer? 2001, a tremendous review on fevers and its relationship to cancers, noted several interesting things. First thing he noted was the data reviewed in this article support earlier observations on the topic that the occurrence of fever in childhood or adulthood may protect against later onset of malignant disease. Seems counterintuitive. If you get a fever as a kid or as an adult, it decreased your risk of cancer later on. How did they come to that conclusion? They list a whole list, I'm not going to read them, but they list a whole list of researchers that showed this association. Oncologists, they all found this. In fact, 10 studies showed the association of fever in childhood with lower risk of cancer later on. Only one showed no association. What can explain the association? One possibility is that just like learning to walk, you need to exercise your muscles. Having a fever in childhood may exercise your immune system to be stronger to handle cancer later on. This hasn't been demonstrated, but it's a hypothesis at this point. After reviewing the studies, he makes another fascinating observation, that spontaneous remissions are often preceded by feverish infections. What observations brought him to that conclusion? Well, another list of researchers noted that when people had cancer and they got a spontaneous remission, that's where the cancer goes away for no apparent reason, it was preceded by a fever in many cases. That was the highest association they found. Additionally, febrile infections have been shown to increase survival expectation in cancer patients. When they got a fever, it increased survival. They noted that hepatitis is a common complication in patients with acute myelogenous leukemia and one which paradoxically increases survival. What happens is, with the leukemia, they would get an anemia. They would transfuse them with blood to correct the anemia, but in the blood they transfused, there was the hepatitis virus. They would get the virus, but paradoxically, it increased their survival because the fever from the virus helped kill or turn on the immune system for helping with the cancer.
So it sounds
about just any fever?
Any fever, yeah. Any means of getting your temperature up.
So it sounds like a fever is a blessing.
It does sound like that, doesn't it? Yes.
But are there fevers like rheumatic?
What?
Some fevers are dangerous though.
Okay. The fevers, if you get a meningitis, you can have a high fever and it can cause brain damage. But it's not the fever causing the brain damage. It's the bacteria causing the brain damage. Fever itself, the only real complication you have is twofold. One, you can get febrile reactions in infants. It does not predispose them to epilepsy later on in life, but it is a complication. You want to try to put cold cloths to the foreheads, try to prevent that. But the other thing is, if you have congestive heart failure and you are not supposed to be exercising, a fever will exercise you and could put you in heart failure if you have that condition. So in those cases, someone with congestive heart failure, you may want to use antipyretics to prevent a fever if they're at that kind of risk. But if you do, the downside is you're going to suppress the immune system. So you have to weigh the pros and cons in that situation. But in most people, that's not an issue. So, and when they looked at references reporting infection and fever in association with spontaneous remissions in neoplastic diseases, they found, here's, by the way, these are cancers that had spontaneous remissions that showed a high association with spontaneous remissions preceded by a fever. They found that of the spontaneous remissions in leukemia, 22% were preceded by a fever. Cancers of the bone, 15% were preceded by a fever. Spontaneous remissions of melanoma, 11% were preceded by a fever. Lymphoma, 7% were preceded by a fever. And his review says, analysis of literature reveals that fevers infection is associated with remission in 22% of leukemic patients, followed by 15% of cancers of the bone and connective tissues, 11% of melanoma cases, 7% of lymphoma cases. These authors concluded that the connection of febrile infection and tumor aggression is the most frequent association found in the literature. Inducing a fever. What would that do? Well, in the review it says, conclusions, pyrogenic substances and more recent use of whole body hyperthermia to mimic the physiologic response to fever have successfully been administered in palliative and curative treatment protocols for metastatic cancer. It's not me saying this, I'm just reading the review of what they've observed. How did they come to that conclusion? Well, the review goes back as far as 1800s, early 1900s. Dr. William Cooley, the leading bone surgeon at Memorial Sloan Kettering Cancer Center of his time, is now called the father of modern immunotherapy. Early in his career, Cooley witnessed a spontaneous remission of a large lymphosarcoma of the head and neck in a patient following a massive streptococcal-induced erysipelas infection. He subsequently deliberately exposed his patients to heat-inactivated cultures of strep pyogenes, the exotoxin containing gram-positive organisms, and Serratia marcescens, an endotoxin containing gram-negative organisms. With this treatment approach and staging methods of his time, Cooley achieved a cure rate of approximately 10%, which at that time was unsurpassed in the treatment of advanced cancer. So he was deliberately giving them not an infection, but the chemicals in the bacteria which stimulate a fever. Yes?
So what about people living in high temperatures like 103, let's say in India, where temperatures are sometimes 106? Or
Acclimatized.
What about
climatic heat would help, would be effective as fever?
if what we're looking at is your core body temperature. That's measured by a rectal thermometer. If we can get it up to 104, that's our goal. Whether it's being out in hot weather, in a steam bath, in a water bath, however you do it, it'll have that beneficial effect.
So
Alrighty.
someone who lives in that area where the temperature is real high, and they would that help their cancer?
It depends. If that high temperature brings their body temperature up, yes. But I can be out 102 degrees, have a hat on and stay cool and be sweating, and if my temperature doesn't go up, it's not going to be a benefit.
Right.
So, fever therapy has had some success as an anti-tumor agent according to articles by several researchers. They've noted this for over 100 years. Now, I believe the most important role of febrile temperatures in cancer is to stimulate the immune system, as noted earlier. Is hyperthermia being used today? Yes, there are two types of hyperthermia. Local hyperthermia heats up just the tumor, leaving the rest of the body at normal temperature. It stimulates getting a skin infection or a boil. If you heat an infection up in your skin, it will come to a head faster. You're stimulating the immune system locally. This is done in Germany with and without chemotherapy. In the U.S., it's only used as an adjunct to chemotherapy or radiation. The other type, so one type is where you heat just the tumor up. Second type is where you heat the whole body up. This is called whole body hyperthermia. This simulates an infection causing a fever. This is done commonly in Germany, as stated, as a standalone treatment for cancer. In the U.S., it is being tested as an adjunct to chemotherapy. How is local hyperthermia done? How do you heat just the tumor up without the whole body being heated up? It's done in a BSD unit. The BSD unit, it uses an MRI, localizes the tumor, focuses microwaves on it to heat the tumor up. The MRI can actually then measure how hot the tumor is getting. And here's an actual unit. In an interview with Mark Dewhurst, Duke University, some time back, they are applying localized heat deep within body tumors. He related that 8 to 10 randomized studies have shown this localized heat improved responses to radiation in the head and neck tumors, glioblastomas, melanomas, locally advanced cervical cancer, local recurrences of breast cancer, and esophageal cancer. So it's increasing the survival. They are also using localized heat in Germany at the Charité Hospital in Berlin. Local heat is applied to deep tumors to increase the response to radiation and chemotherapy. At the Charité Hospital, Dr. Peter Wurst said that a report in Cancer Research indicates this doubles the rate of survival. It actually improves survival rates. It's also being used in China. This is where, yes ma'am.
So they just don't want to let that chemotherapy go, do they?
Yeah, that may be. That may be. In Germany, however, they have in their constitution freedom of medical practice, like we have freedom of religion here, and they have it as standalone treatments there. In China, this is what they found. They are using the BSD unit there, and they've done studies, and they took 60 patients with non-small cell lung cancer and that had local hyperthermia added to chemotherapy. Adding localized hyperthermia increased the complete remission rate from 37% to 63%, practically doubled it. Partial response was increased from 40 to 77%. Stage 4 head and neck cancer. Adding hyperthermia to radiation improved the tumor disappearance rate from 41% to 83%, doubled it. It improved local relapse-free survival from 24 to 68%, and it improved 5-year survival from 0 to 53%. Dramatic increase in survival.
By adding heat.
By adding heat.
So
Yeah.
what about just the heat alone?
What?
What about just the heat?
Yeah, it's hard to find studies like that, yes. Yeah, good question. But they are doing it in Germany. I was actually able to go over to Germany and see them doing heat treatments, whole body treatments, but we'll get there. Now, they had to halt this study due to ethical reasons based on the strong improvement found by adding hyperthermia. They couldn't in good conscience withhold it from the controlled group. Several studies were done on pancreatic cancer using chemotherapy with and without local hyperthermia. In the Verona study, adding local hyperthermia increased 24 months survival from 19% to 36%, doubled it. Now, they used 2-month survivals because pancreatic patients generally don't live 5 years, so they have to do shorter ones. And because of the good response, in May 2007, BSD units were introduced in the Cancer Treatment Centers of America. It is available in the United States. Is whole body hyperthermia being used today? Well, in Germany, it's being used as a standalone treatment for cancers. Now, in the early years, it was believed that the benefit from high temperatures came because the high temperature was killing the cancer cells outright. To do this, the very highest temperatures that a human could stand were used. In 1995, 103 patients previously treated with all conventional treatments were in a stage of uncontrollable progression and METs. They used infrared lamps to give hyperthermia 107.6 degrees Fahrenheit. Under general anesthesia, they had to anesthetize them. 50% had a positive therapeutic result. However, there were toxic side effects at that high temperature. These toxic side effects were demonstrated in the study in the Netherlands. 27 patients were treated with whole body hyperthermia alone or in combination with chemotherapy or radiotherapy. Whole body hyperthermia was performed in the Pomp Siemens cabin with hot air and warm water mattresses, patients covered with plastic film to avoid cooling by perspiration. The heat treatment lasted 2 hours, and they got 107.2 to 107.6. That was under general anesthesia. These are rectal temperatures. Should be. Toxicity such as liver damage, respiratory problems was considerable. There were 2 fatalities from the hyperthermia. Hyperthermia gave an improved therapeutic effect in 6 of the patients. Considerable pain relief was observed in 8 of the 10 patients. Whole body hyperthermia at 42 degrees Celsius can be effective, but potential toxicity limits its use to those patients with severe complaints for whom no other palliative treatment is available. So basically said, if you survive the hyperthermia, it will have a benefit. But you may not survive at this temperature. Since then, our understanding of the beneficial effects of hyperthermia is to turn on the immune system, not to kill the cancer cells outright. To turn on the immune system, you don't need 107, excuse me. Ideal is about 104 rectal. That's pretty close to your core body temperature, which translates to 103 oral temperature, which the further away you get from the center of the body, which translates to about 102 axillary temperature. And those are what we shoot for. This is now the accepted target when you're using hyperthermia for cancers. In America, has heat been applied to the whole body rather than just local tumors? Well, University of Texas, they did experiments. Dr. Bull, they did anesthesia. They would bring the temperature up to treat cancers. And patients placed under general sedation. The body's then heated to 104 degrees Fahrenheit, rectal temperatures, for about 6 hours as an adjunct to chemotherapy. Patient described in the interview had a lung cancer, and the tumor had responded to the treatment with decrease in size. Whole body hyperthermia is important to help treat distant metastasis. So, in Germany, they do standalone hyperthermia treatments. We had one patient I got to see over there. They put him in on a table, curtains around it, infrared lamps. They have infrared lamps there that we do not have. They have what they call a water filter in them. What happens is when it's the infrared lamps, the infrared wavelength that heats your body up from the inside out, it'll go in a couple inches. That's what we want. When you get from the sun, however, it gives you ultraviolet light as well. Ultraviolet is what gives you the sunburn. Water screens out the ultraviolet and allows the infrared to pass through. That's why in the desert, where there is no water, you get a sunburn very quickly. In Maryland, where it's humid, I can be out in the sun, no sunburn. I thought, what's the difference? Target in about 20 minutes. Then we hold it there for another 20 minutes. And then ideally, if you can get out and wrap you up in blankets, keep you warm for another 30 minutes or so, you get close to an hour. And that's really what we would like. I give you the protocol in your cancer manual of how to do it at home. The nice thing is you don't need a BSD unit, you don't need a lot of fancy equipment. I gave my wife her first treatment in bathtub. She had breast cancer with mets to the axillary lymph nodes. They'd done initial lumpectomies. They were going to do further surgery but she had mets to the axillary lymph nodes. And before she went in for further surgery, we did fever baths in a bathtub about once a week for 6 weeks. She went back in and lymph nodes were clean and the cancer had disappeared from around the...
Got her temperature up to what, about 104?
Well, she got about 105. I mean, that was more than... I told her, don't do that. I mean, it wiped her out for a couple of days.
Yeah.
She didn't need to go that high. But yeah, no, she responded very well. Now, for people that are not physically active, it can decrease your oxygen saturation because it's like running up a mountain, and they can become delirious. They are actually preparing to die. They will start confessing their sins. I thought, really? No. And well, the first patient we did, that happened, and it's real. You can avoid that because what happens is the oxygen saturation drops, like you're exercising. You just give them oxygen, nasal cannula. That's why we have oxygen concentrators at each of the hyperthermia things. You give the oxygen, it eliminates that.
So you're saying you can get the temperature up for the length of time that you need by giving them oxygen.
Oxygen can keep the oxygen saturation up so they don't become delirious. Now, if on the other hand, we had a friend of hers was a runner, ran every day, got into the fever bath, and said, oh, this is comfortable, started reading a book. So if you have good cardiovascular system, you can handle the fever baths much better than someone who doesn't. But just like running up a mountain, first time you do it, you may not be able to run the whole way, but your body will become conditioned, and you can become conditioned to handle fever baths. Your cardiovascular system can grow and develop and strengthen to where you can handle them better later than earlier. That's it.